muted completely.
Right? Remember?
Yeah.
Oh, I have audio issues. I don't know why. I have a couple questions, actually. I don't know if you know any of these answers. I should probably get in my class. But the question, like so even though my waiting room is disabled and like it says right now, like 5 people are in the waiting room, like I have changed it so that I don't have to wait for that. It does not change it.
Oh, you still have to admit them?
Mm-hmm.
Yeah.
And the other problem I have is when I am sharing my screen, not when I'm sharing, but when I have my slides open and I want to, like if I don't want this huge screen and I go to present mode, right? When I go to present mode, I cannot make the screen smaller. It's the weirdest thing. The image.
For when you're showing them your slides?
Mm-hmm.
It does it too big or too small?
It does it too big. Actually, I just figured something out. Oh my God, I figured out, wait, did I figure this out? I might have just figured something out myself. I think I did.
Do you have anyone in the waiting room?
I do. I'm going to put 7 people in my class right now.
Okay.
Did you give it back to me?
Yes.
Okay. Okay, so let's do this. Oh, I figured something out. Okay, there we go. Hi, everybody. Sorry, I was having a little bit of support with Megan, who's my wonderful support. But you can hear me, right?
Yeah. I can.
Hear me. You can see me. I'm wearing my Get Set Up t-shirt, but I do not like to put my Get Set Up t-shirt on with my Get Set Up background because it makes me really dark. And I don't. And anyway, hi, everybody. I'd love to see your faces. I'm showing you mine, so I'm going to make you show me yours.
How do I do that? Start video, I guess. Start
video. You go. There you go.
There I am. Hello.
Hello. Who's speaking? I'm sorry, I don't even know.
Me. My name is Bonnie Pysick.
Hi, Bonnie. I don't see you, though.
So how do I do that? Start video?
Yes.
Okay, FaceTime, choose virtual video settings, select a camera.
Select a camera. And then you'll want to go to, see, I'm not even touching my screen.
Time, build it.
No. And then you'll want to make sure you're on, like, it says like computer camera, or it might say something like that. I see Roger's hand. I can't see Bonnie. I can't see Sue. I see Bonnie. There you are. Hello, Bonnie, with your San Francisco Bridge background. Joyce?
Yes, that's me.
Hi, guys. I'm sorry. I'm still nursing my coffee from 7 a.m. But it's only 12:30 in Denver. Well, I don't know where all of you are from, but.
Pennsylvania.
Martin, where are you from?
Florida.
Oh, that's nice. And Roger?
I don't see Roger.
I see Roger's hand.
You see, that's me.
So Bonnie, you are probably in speaker view. You probably need to go to gallery view. You know what? I'm going to have Megan jump on with you and help you figure some of this stuff out.
All right.
Okay, guys. Hi. Welcome. Have any of you taken this class before?
No.
No? Okay. That's good. That makes me feel good because then that means that when I'm teaching, you're learning, people are learning so they don't have to take this class a second time. But it's never too, you can always use a refresher. So just quickly, before we get started, I'm Wendy. I'm your Get Set Up guide today. Most of you have taken Get Set Up classes, I assume, so you know what a great organization this is. We're like seniors, or I call us mature adults, teaching other mature adults wonderful, helpful, information, technology, exercise, anything, kind of travel, whatever you want to do. We'll take you there. We don't get any kickbacks for anything we sell. I'm not selling anything to you except for my knowledge today, but we don't receive anything. And if you would like a recording of this, I am going to record this class, and at the end of it, we will send you a email that has some notes, and that notes has an email called help@getsetup.io. You can email them and let them know you'd like the recording of this class. Okay.
Nobody's helping me. I'm still here.
Oh, okay. Well, you know what? Just hang on. As long as you can see me, that's all you need to see.
Where are you? Oh, you're the top, Wendy.
I'm Wendy. I am your guide. That's all you need to see is me, because I'll be sharing my screen. I'm sharing a screen. You guys should be able to see it. Can you? It says stroke awareness.
Yes.
Great.
Yes.
I just have a question. Is it pretty big on your screen or is it pretty little?
Your everybody's face is about 1 inch by 2 inches.
Okay, Bonnie, thanks. No, I'm wondering if my screen sharing is big enough for you guys to see it.
Yes.
Yeah.
For me.
Yes.
I play around with this and I'm asking you guys because I'm working off of like a really big monitor and I don't really know how it comes through to you guys, and I want it to be big because it's the whole show here. Okay, so tiny bit about me, not too much. I am from Colorado, beautiful Colorado. I was a former physician assistant, and that's where I got all my medical knowledge. I taught in the physician assistant program at the University of Colorado School of Medicine, and I've always had a bent for technology, so I went to work for Apple. I stole all of their tricks, and then I opened my own company so that I could teach older adults about technology, and then the pandemic hit, and I found Get Set Up, and here I am. So I love teaching. I love helping. This class is very deeply, deeply personal to me. My husband, who's quite young, had a stroke August 1st of this year. And because of my knowledge, I believe I saved his life. And actually, not only that, he has zero anything, come from the stroke. So he's doing just great. And I decided to teach this class because it's super, super easy to learn the symptoms and signs of a stroke and help someone if they're having it. Okay, so today, that's not what I wanted. We do learn from each other, and you are welcome to share with me anything that's gone on in your life that's appropriately related to this class. If you just want to share some thoughts, I am open. I'm sure the other people on this Zoom call as well. We learn from each other, and so please, please, please share. So today is a little bit of information, a lot of information, a little bit of important information, and it's the most important. And I don't talk a lot about a lot of other things because that's what's important. We're going to learn the signs and symptoms of a stroke, what to do when you're possibly helping someone and waiting for 911 to arrive, what not to do, and why time is so, so, so important when you are potentially treating a stroke patient. All right. So let me just tell you quickly what a stroke is. A stroke is when the blood flow in your brain is interrupted or reduced, preventing your brain from getting oxygen. When your brain doesn't get oxygen, it then can't perform all of its necessary jobs, including sending messages through your nerves or through, the blood supply for your muscles, anything to act. So we have deficits that happen. There's two kinds of strokes. There's an ischemic stroke, and that happens when the language is a blood clot launches. Launch means it goes from one location in the body, generally the heart, up to the brain. That is the most common kind of stroke, and that is the stroke that we'll be talking about today. The hemorrhagic stroke is when there's already something going on in the brain and it bleeds. So again, blood flow is decreased and therefore oxygen is decreased because the blood is going out of that artery. Okay? So those are the two kinds, ischemic and hemorrhagic. Like I said, most 80% or something of all strokes are ischemic, and those are the ones that you'll be able to hopefully take care of and get some help. All right, so this is the bread and butter of this class. The American Stroke Society came up with this acronym, and it has some meaning. So FAST, that means we want to act fast. The symptoms and signs of a stroke are: F is for facial drooping. You will see the patient, if they're having a stroke and if they're showing this symptom, their face will have like a little bit of drooping on one side. You'll ask them to smile, and the smile will not be even on both sides. I'll show you pictures. That is the F for facial drooping. A is arm weakness. It is going to occur on the same side. If there's facial drooping and there's arm weakness, it's going to be on the same side. And you're generally going to ask the person to squeeze your fingers, and they're not going to be able to have like much strength in that. You can ask them to lift their arm, and they're not going to be able to do that either. A lot of times you'll see the patient kind of like this. If they're on a couch or they're on a chair or somewhere, or they're on a table, you may not even notice the arm, but the location of the stroke in the brain is on the opposite side of where you're seeing the facial drooping and the arm weakness. Just information. So we have F for facial drooping, A for arm weakness, S is for speech difficulty. If you ask the patient to say something, you might notice a little bit of like a slur, or they drop a word or a little bit. It's not going to happen if you ask them a one-word answer question. So, are you okay? Yes or no. It's not going to really help you identify any speech difficulty. If you ask them to repeat, the preamble or the alphabet or something, you'll probably notice it.
Yes, Jennifer.
Let's put him on. Let's see. Okay, sorry. So it's just really important to remember that the person that's having a stroke does not really know what they can't do. They're not feeling their facial expression not being even. They're not really feeling their arm weakness unless they go to get up or something. Again, the speech difficulty only happens when they're like saying a sentence or something. You're not gonna notice it. And hopefully one of these signs and symptoms will present itself, but sometimes it doesn't. The T is for time to call 911. Now, I know that the Stroke Association made it so that the T is at the end because it stands for fast. But I'm going to be really honest with you. If you get to the person and you notice F, even facial drooping, you call 911. Okay? So the reason that it is so important to call 911 so quickly is because the longer the person is without oxygen in their brain, the more likely the outcome, the deficits, the end result is not going to be as good. There is a medication called TPA. It stands for tissue plasminogen activator. It can be given up to about 4 hours in a stroke patient that is having an ischemic stroke, and it will begin to reduce the effects. It starts to coagulate. It starts to stop the bleeding. Okay. So, and open up things so that it will open up the clot so that you can have transmission of the blood and oxygen through to the brain. So we're going to get to that in a little bit. But I want to be really mindful that you might see these, you might not. If you are with someone or you come upon someone and they're on the ground, you call 911. I don't care if they say they're fine. Anyone who was upright and is now on the ground and they don't know why, you call 911. Okay? We have gotten very, I'm not even sure what the word is. I think scared. Okay. COVID has put us all in this crazy world of being like, we don't want to go to the hospital. Trust me, you do. And thank God our country is doing well enough that you're safer in the hospital with a stroke, if that's what you're having, than anywhere else. So that leads me to talk to you about something else. You know, because of COVID, we're not with as many people. We're not going to lunch. We're not having our card games. We're not doing things with people and talking about all the silly things that we normally talk about. So therefore, we are not saying, gosh, you know, I've been so tired lately, or I didn't sleep that well, or I've had a little bit of a headache. So we're just not sharing information that we used to share. Try, please, to start sharing. Share, overshare, because there are a couple of things that sort of precede strokes that might help us know that maybe we should get to the hospital and see if everything's okay. Check on people more. Check on people that live alone a couple times a day. Check in, if you live alone, check in with someone a couple times a day. Just, hey, how are you? And the I'm okay is not a good answer. You know, you need to delve a little bit deeper. Have you had any headaches? Not every time, but just be aware that as we get older, our bodies are getting older, and there are signs and symptoms within our bodies that are telling us that things are not quite right. So I want you to just be really, really mindful that it is so important to let people know about you. Again, I'm a little more tired than usual. I've had some headaches. I don't feel exactly right. And don't assume that you're going to be fine. Call 911. They would rather come to your house 100 times and be able to say, you're fine, we're going to leave, have a nice day. Don't assume that you can treat a stroke patient. Don't assume that you can get the stroke patient to the hospital faster than anyone. And please don't assume that, oh, he's not having a stroke because he's talking cognitively fine. Stroke patients for a long time will answer all your questions just perfectly. You can ask them to recite whatever you want or to remember things. It is not a memory cognitive deficit that happens initially. It's more muscle. And that's why it goes quickly from sort of nerve muscle and these kinds of signs and symptoms to then more cognitive things. But initially, you're gonna be like, what are you doing on the ground? I don't know. I mean, I got to my husband. So the story with me was that I was in my kitchen and I heard something fall, but I didn't know what. And then I heard the same thing fall again. Well, we have two giant dogs, and my husband was holding the dog food bowl, and he had two of them, and they had, you know, like 3 cups of food in each of them, and one fell, and then the other fell. And it's like I go around the corner, and he's on the ground, no idea how he got there. The dog food is everywhere, and I'm approaching him. I'm at a distance of maybe 20 feet, and as I'm approaching him, I can see that things aren't right. And I ask him to smile before I even get to him, and I see that he is not smiling equally. And I call 911. And so again, if you identify something earlier, like if you get there or they're on the ground and they weren't, please call 911. Okay, I think you got it. I think I made my point. Okay. This is what the signs of a stroke will look like if this person is exhibiting this. All 3 people on the top row are having a stroke, and as you can tell, they are not able to equally smile, okay? So this is kind of a normal presentation, and what I want to really show you about this is that the gentleman in the middle with the glasses, he doesn't have a big smile anyway. He doesn't have a real big smile. So his left side, your right side, his left side is actually his smiling side. He's smiling, but it doesn't really look like it too much, right? So you kind of have to know the person's baseline to know if they're not smiling right, but trust me, you will know when you get to them. And then the arm, the drooping arm is a classic, okay? So you now you're a hero and you have called 911. You have done your job. You get a pass to live your life with knowing you've got the Hero's Award. However, there's some things that you can share with 911 that are going to help even more than you already just called them. When you call 911, you're going to get to a dispatcher and they're going to ask you what's going on and you're going to tell them. And then they're going to ask you, you're going to say, I think they're having a stroke. And they're going to say, did you do all these tests? And they're going to ask you the exact same questions that I just showed you about the face, the arm, the speech, etc. They are transmitting every word that you say to the paramedics that are on their way. And so anything that you tell them is speeding up the paramedics' knowledge when they arrive. And that is time. Okay. If you know the patient's medications, if you know what they're taking, that is important to share as well. If the patient is a diabetic and has, taken insulin or recently or not, the paramedics will, it's helpful because they're going to come in. The first thing they're going to do is a blood sugar test to see what's going on. So that will help. If you can tell them about any underlying health conditions, high cholesterol, diabetes, MS, whatever's going on with that patient, that will help. And then, of course, the results of the FAST test, which you have already done, they have done in a second, and you're just transmitting more information that is just to help them. Okay. So now it is your time to take a test. So with your eyes closed and your mind very, very, very focused, I want you to say to yourself the first letter of the acronym and what it stands for. Everybody got it? Okay, here's your big test. Okay, so you got it. It's F for facial drooping. Now I want you to tell me the next letter. Tell yourself the next letter and what it stands for and how to assess it. Okay, you got it. It's arm weakness, and so grip strength. And then the next letter and the how you test it. Okay, and this one again is probably the least noticeable at that moment. And then, of course, we all know this, which I kind of always slide my T up, but it doesn't, that's not good for the word. So if you can remember one of these things, you are saving this person's life and helping them get to the hospital to get this TPA and to get treatment. All right. So this person is on the ground or on the couch or wherever they are. There's some things that you need to do, and you can leave them there. You need to unlock the door, open the garage, do whatever you are going to do to help the paramedics access the patient. And you're still on the phone, or you've put it down, but the dispatcher has not left you. They will not hang up until they'll tell you, are you ready for me to hang up? If you unlock the door or open the garage or call security or call your apartment or whatever and say, that is time. If the paramedics don't have to go to the front door and ring the bell and wait for you to open it, or you can open the garage and just tell them, they're going to know everything. They come in, and that is time, that is minutes that are so helpful. If you can get the patient or the person who's on the ground or the person you're suspected is having a stroke, if you can get their medications, that'd be great. If you can't, treatment will not be changed or delayed based on that. If you can get them, that'd be great. So this is an opportunity I want to tell all of you right now. Everyone should have a medication list written down on paper, printed in 2 places in your house. These apps on our phone are great for storing things, but not if you can't get into your spouse's, friends, whatever's phone and quickly access it. You get nervous, you can't move your finger so fast to do that. Patients' medications are important because they help the paramedics and they help whoever's taking care of them in the ER. Again, treatment is not delayed or changed probably, but it's just an awareness of what is going on. So the hospital, the best hospital is always, people always ask, why? What's with that? So every hospital has an area that they specialize in. They may specialize in more than one. There are hospitals that do specialize in treating stroke patients. And the way they specialize in them is that they have set up in their emergency room the ability to triage that patient quickly from coming in from the ambulance, getting the CAT scan, getting the TPA, getting the MRI, just like all these things, okay? So they are like, it's like this, they don't have to wait to say, like to arrive and then, the paramedics have called them ahead of time. But here's the deal with the hospital. If you have an option to go to a hospital that you know specializes in strokes, go there. The way you find out how a hospital specializes is you either call them or call your fire department that's close and say, where do you normally take patients? Who has the best stroke emergency room? If you are equal distance, that's what you do. If there is a hospital that is 20 minutes and they're the best at strokes, but there's a hospital that's 5 minutes and they're best in orthopedics, you go to the closest hospital. They will have the medication to give you to at least buy you some time. You go to the closest hospital. The only reason I say that best hospital is if there's an equal, if it's 5 minutes or 10 minutes one way, that's okay. But if it's 20 minutes and 5 minutes, that's a big difference. So the paramedics generally know the hospitals in the area and they will take you. If you're in a smaller community and you only have community hospitals near you, they will have TPA. People frequently ask, can TPA be given in the ambulance? And the answer is no, unless the ambulance has a CT scanner on their truck. You cannot give TPA to a patient that's having a hemorrhagic stroke. They're already bleeding. You don't want to open up anything more. That is why they do a CAT scan quickly to decide if they're going to give TPA. So I've read that there's a few ambulance companies in the country that are putting CAT scanners on their trucks, and they can do that. But for the most part, the answer is no, they will not give you that medication. Okay. So almost every community hospital will have TPA. It's a very, very, very common, easy, accessible drug now, and it will be given after a CAT scan. Okay, things not to do. Do not give the patient any water, any food, anything at all by mouth. There's a couple reasons. One, as we know, prior to any procedure or surgery, they always say don't drink or eat anything. Now, granted, if this is happening at the dinner table, you can't do anything about it. So like people that get in a car accident, they might be eating their cheeseburger. They're not going to not do, the most important or the best intervention, but it helps. Also, you don't know the level of the stroke. So the stroke might be affecting, like their arm at the moment, but it might be also affecting their esophagus or, anything within their swallowing organs. So don't give them anything. You can put a cold washcloth on their face, but don't give them anything to eat or drink. And don't move them. They're going to probably not look very comfortable to you. They're going to be like kind of to the side and kind of like, and they're looking uncomfortable. They're not uncomfortable. They don't feel their discomfort. You feel it. Don't move them. Again, you don't know for sure they're having a stroke. You don't want to cause more harm. You don't want to possibly, elicit more, the stroke to move a little bit. Just leave them. They are fine. And they are fine for you to leave to go to unlock the door. They are fine for you to leave to get their medications. They're not getting up and going anywhere, I promise. Okay. So super, super, super important information there. All right. If you do everything right, you end up with your spouse or with your whoever that you're supposed to end up with. I got very lucky. This is pictures taken before this happened, but because I knew what to do, I was able to act so fast. My husband had TPA in his system 46 minutes after I called 911. It's like, and he was out of the hospital in less than 48 hours. And they're like, what did you do? And the reason was basically because, you know, I was quick. I knew what to do. And now you do too. Knowledge is power. Power is knowledge. And both of those are security and are like you've just given yourself, like, just like I said, an award. Generally, knowledge and power bring you calmness because you know what to do. It doesn't matter what kind of person you are. You can be someone who gets crazy nervous during something that's going on, or you can be a calm person. I don't care what kind of person you are, just call 911. You've done your job. You have saved that person from having the worst outcome. You know, you have done everything you can. And the paramedics are going to be so appreciative of the things you've done by opening the door and by possibly getting their medications. And it just saves conversation time. It saves, I mean, I'm not going to lie to you. The paramedics came in to my house. I couldn't make it from leaving my husband when they came in, going to my bedroom to get one thing, and not, you know, that big of a house. I went to my bedroom and I came back and he was already in the ambulance. It was like, whoa, like literally, because they knew already that I had done the fast test, that I had told them his underlying conditions, that I had handed the paramedic his medications. It was like, woo, like they were on their way and they were going to be there. So there's just so many ways that we can help save ourselves or save the other person. And they're easy. They're just easy. Fortunately, 911 is now doing better with cell phones, because for a while I think there still is, you have to disable, I can't remember exactly how it works, but if you want to have the ability for 911 on your phone, you are telling the carrier that they're not responsible. But I don't know how that works right now. But the bottom line is that 911 can find you through your cell phone. They can find exactly where you're at. However, if you're in a remote place, you're in a cabin in the mountains, you're up a road and cell service is not great, and you're calling 911 and you're talking to the dispatcher, you can tell them it's the third left, or it's the house without the light, or whatever. They're going to tell the paramedics that. That's another reason for you to stay on the phone with them, and they will stay on the phone with you. But the more information you give to that dispatcher, everything goes directly to the paramedics. Okay. And you have given them so much information. And that's kind of the end of our class. It's just that it's not, you know, fortunately it doesn't take an hour to save a life. The important thing is that you feel empowered and that you feel like you could do something if someone is having a stroke, or if someone is on the ground and they don't know how they got there. It is just crucial that we at our ages begin to acknowledge that we can't probably do anything for ourselves that's going to help us if we're on the ground. We need to get help. And I can't emphasize that enough. Just don't say to your spouse or your friend or whatever, drive me to the hospital, I'm kind of not feeling great. You call 911, okay? Because you probably, I don't know if any of you know this, but if you drive yourself to the hospital, you go through the same door as everyone else who broke their arm. If you come on an ambulance, you go through another door and you are treated immediately. That's a rule for anything. If you've got time, if you think it's just a broken arm, drive yourself. If you're bleeding, if you've hit your head, if you're suspecting something, you get in an ambulance, because even though they might arrive at your house a few minutes later, they've got some wheels, they've got some lights, they got some speed, and they have access. So make sure that you are in an ambulance, okay? So again, if you want a recording of this, we can get you a recording. I think that you all now are empowered to save a life, help reduce the outcome of a severe stroke by just knowing the FAST acronym. Share it, write it down, say it in the shower, say it when you're brushing your teeth. Just remember that you are in charge. And that's, really the bottom line. If you are in charge, then you can make a difference. I teach a lot of different classes that get set up. I teach health and wellness classes, exercise. I teach some technology classes because I used to work for Apple. I think I told you that. I was like an Apple. So I teach a lot of tech classes. I teach whatever they ask me to teach within reason of what I'm interested in and what I'm capable of. But I love to teach. I love you guys to know. And it's just important that we share and that we talk and that we get our community back. I think the vaccine is going to help us. I think we're all like about there. I don't know about you guys in Florida. God willing, I hope. Did you get your vaccine, Martin? You just have to unmute it. Here, I might be able to do it for you.
Yes.
You did?
Yes.
Okay, good. Because the partiers in Florida are making the rest of us look terrible.
Yes.
Let's see,
I
somebody,
worry
I
about
think,
that.
yeah. How high does your blood pressure have to be to have a stroke? That is not something I can answer. There are some things that can increase your risk of having a stroke. One of them is high blood pressure. One of them is an irregular heart rhythm called AFib. There's, a variety of things that can increase your risk of a stroke. But the most important things you can do are to eat healthy, exercise a little, just, walk, move around, and stay in touch with people. Be mindful that you are isolated. I will share this with you. TIAs are brought up sometimes. Those are transient ischemic attacks. The funny thing about TIAs is that you don't even know you've had it. They're so transient that they're literally like a wisp of air. The person watching you, if they're watching you, will know it and you won't. So it's very hard to say, I've had a lot of TIAs if no one's been around to see them. They happen so fast, and they generally happen like you'll be holding a glass of water and you'll drop it and be like, what happened? How did I do that? Or you'll be talking to someone and you'll kind of slur a word and you'll be right back on track in 1 second. So TIAs, many of them can be a precursor that there's going to be a bigger stroke. Not always, but it's just kind of funny because you don't know it. And it's funny, you don't really know you're having a stroke when you're having a stroke, unless you have someone around you like me to say, I think you're having a stroke. But, just be aware. Again, if someone's on the ground and they didn't get there, they don't know how they got there, you call 911. Any other questions? Any other thoughts? Anybody want to share anything? No? Bonnie, did you have something to share? You have to take me off your speaker. You have to unmute yourself.
I just wanted to thank you. Your presentation was very informative and helpful, and I appreciate the opportunity to listen to you. And I would like to take your iPad basics. So now I know if I go on, I have to look for Wendy to give the
I'm the only one that teaches that. I just got done teaching that class. And I teach it every week. I teach it a couple times a week. I teach iPad basic, intermediate, and advanced classes. I'm teaching a class on My Fitness Pal, which is it's an application actually that just kind of tracks your nutrition and your steps and stuff that people wanted to know about. So I'm teaching that. And I'm teaching a class on how to find some exercise programs on the internet. And, it's really just important to share knowledge. I don't have all the knowledge about everything. I have a lot of knowledge of a lot of crazy things, but I also have knowledge that I think is helpful. And if you have anything that you would like to learn that is not in Get Setup's class list, share it with us. We will try to put a class together. If you have something special to share, you have something interesting, you can be an ambassador and share that during one of our social hours. We love to have our learners teach a class, talk, do whatever. Talk about anything.
Are you teaching the iPhone basics on Friday at 10:30 a.m.?
You know, it's funny. I typically am going to start teaching those classes. I am not teaching them this week.
Oh, because I love you. I think you're the best one I've heard so far.
It's funny. I am going to start teaching that class, unfortunately, this week. So I'm taking those over from Wade this week because we just made that decision for me to take over Wade's iPhone classes. I'm not teaching it this week. So you can catch me, I think, whenever the next one is. I'm going to be teaching that. And, it's next. It's, I don't know my schedule. Unfortunately, Get Set Up is awesome in a million ways, except for letting all of us guides know very much in advance. Let's see if I'm teaching it next week. I'm teaching the iPad Basics class on Monday at 3:00. And then I'm teaching, let's see, I don't see myself on the schedule, but it will come up. The iPhone classes. There's a really good iPhone class that I'm going to teach, guys, and it's a safety features class. And it's going to teach you how to load your health information on your phone and how to just keep yourself safer on the iPhone with some of the apps and some of the cool things that the iPhone has, how to really use Siri, how to make sure. So I don't know if any of you guys have this new Apple Watch. I don't, but the new Apple Watch is so cool. I'm not teaching a class on it. I have an Apple Watch. It's not my favorite toy. If you fall or something, it will literally ask you, are you okay? And then it will ask if you want them to call someone to tell them or send them a text or something. It's crazy, but it's cool. So be well, be strong, take care of yourself and each other. Let us know if you like this class, if you want to learn more. We want to know what we didn't do right. I prefer that feedback versus you were great, even though whatever you want to say. But I'd like to know what I could do to make this class better for you. So share and care about everyone around you. And we will see you another time.
Are you teaching the iPhone safety on 3/26 at 2 p.m. or staying safe on iPhone on Wednesday, March 31st at 11 a.m.?
Boy, you are good. I'm not teaching it on March 31st because I'm teaching an exercise, the importance of exercise. What is the next one that you're asking? Another iPhone
March
class?
26th. That's tomorrow.
That's tomorrow. I'm not teaching that. No, I'm not teaching that.
Okay.
But after this week or after next week, I should be more on the schedule for teaching those. I know that Get Set Up, you can well imagine, us guides are all over the world, literally India to Australia to the United States. And we are trying to have programming going on 24/7. And I'm not teaching 40 hours a week. I can't do that. I have another life. But the scheduling is a little bit challenging. So, yeah.
Do you have an email so that somebody can communicate with you offline?
Can I give you my email?
Yes.
Is that what you said?
Yes.
I don't know if I'm allowed to do that, but I'm going to do that. It's wemiller1@gmail.
wemiller1?
Mm-hmm. wemiller1@gmail. And I just
the numeral one?
Yeah. Yeah. So, guys, just enjoy, get outside. That's the other thing. You must get outside every day. I don't care if it's for 5 minutes or 500 minutes. You must get outside every day. It's the most important. It's probably the most important way to reduce the risk of a stroke.
Is weight a problem with getting a stroke?
Weight can be. It's one of the top things, but it's all a combination. I think stress can be, I think that we all don't know a lot about everything. I think they take the pool of people that I know AFib. I do know that AFib is a very, 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 very common. The number one reason people have strokes is uncontrolled AFib. So not being on blood thinners, but other things, and strokes don't have any preference to age or race or anything else. They don't care. So I got to run, I think, in a minute. Oh, no, I don't know. I'm early. I'm going to have to teach my next class. But any other questions, any other thoughts, anything else that you guys want to share about anything? No?
My husband had many TIAs before I finally lost him. So I can relate to a lot of what you said, and it was an excellent presentation.
I'm so glad. Well, I'm very sorry for your loss, and I really hope to be able to teach more classes to help us be more in tune with our bodies and help prevent things that, we all want to live to kiss our grandchildren if we can just get out of this pandemic, right?
Yes.
But we're close. We're close.
We're getting there.
We're getting there. I have a wedding this summer. My daughter's getting married. It's already been postponed 1 year, so we have to get there. So
I know the feeling.
yeah. Okay. Have a wonderful day. Be safe, and I will see you soon.
Thank you.
Okay. Bye-bye.
Bye.